This is Dr. Harold Pierre. Thank you for choosing me as your doctor. For all other viewers, please consult your physicians to determine how this information applies to you. Drug and alcohol dependence are disorders characterized by a chronic course with frequent lapses and relapses. It is important for us to put the relapse rate into perspective because the numbers are quite shocking. Within the first month of completing detox, up to 55% of heroin addicts have relapsed. Within 6 months, that number has increased to 93% of these patients. And by the end of the first year, up to 97% of heroin addicts have already relapsed. This isn't an issue isolated to just heroin addiction. Prescription painkillers, opiates, however you want to call it, the relapse rates after detox are strikingly similar. This isn't just a human problem. We can't even keep laboratory rats from relapsing. If we can determine the psychological and physical triggers for relapses, perhaps preventive measures could be initiated at the start of treatment and therefore increase the overall success rate. This was partly the goal of Raj and colleagues. In this year 2000 article, an attempt was made to understand the factors leading to first use and relapse in opioid dependence. In a community treatment center located in West Delhi, India, 25 consecutive patients attending the clinic and meeting the following criteria were enrolled in this study. Each patient met criteria for opioid dependence. The patients were previously treated at the center for a year. They experienced a period of at least 3 weeks of abstinence in that year. And lastly, each experienced a lapse or relapse. Now, at this clinic, patients with drug and alcohol dependence receive psychological counseling as well as drug treatment. Now, the authors defined a lapse as any opioid use in the 1-year period, and relapse was generously defined as opioid use occurring at least 4 times per week. These 25 men were interviewed to determine the circumstances around their reuse of opiates and if that reuse persisted, leading to relapse. Of the 25 subjects interviewed, after the first use of opiates, 76% of the men relapse, 20% use infrequently, and only 1 person used opiates once in that entire year. The number 1 trigger for first use of opiates were persistent sleep disturbances. As for relapses, the number 1 triggers were persistent body aches. On average, relapses occurred 8.7 days after the first use of opiates. This study highlights the importance for the physician to eliminate signs of withdrawal as soon as possible so to avoid triggering a lapse. Fact is that soon after a lapse, full relapse may follow. I have several completed videos that I will upload soon discussing important medications that help mitigate these symptoms. Opiates were not the only substances used. 65% of the men reported using alcohol and cannabis, while 23% used benzodiazepines. Although these men were of Indian descent, alcohol, cannabis, and benzodiazepines are frequently abused around the world. Now, this study is an important reminder that despite patients making a number of visits to the rehab center, receiving drug therapy as well as psychological therapy, relapses still occurred. Now, the fact may be that 3 weeks of abstinence is not adequate for biological disturbances to recover, as well as psychological changes to recover. Now, I already know the pitchforks are coming out, and there's a chorus of people claiming that addicts are just weak people. But since 1999, I have cared for hundreds, if not thousands, of heroin and other opiate addicts. And as a practicing anesthesiologist, I've administered tens of thousands of doses of very powerful opioid medications to surgical patients. And yet, I've found the ability for heroin and opioid addicts to endure mental as well as physical pain second to none. So I'm providing these educational videos to my patients, definitely their friends and family, because I want to make sure they fully understand how difficult of a challenge that you have to overcome addiction. But I also want you to know that there are scientific reasons behind the medications that I'm choosing for your care. And because every single day I'm reading multiple articles related to addiction and your individual health needs, that I might make abrupt changes. And that abrupt change is guided by your circumstance and the medical science.